This is Group 1's presentation of Informatics System Infrastructure. Presenters include Samantha Roberts, Sarah Webster, Lenny Simmons, and Jackie Tran.
You may be asking, what is an infrastructure? Well, that's a good question. An infrastructure, as defined by Merriam-Webster, is the underlying foundation or basic framework as of a system or organization. When establishing an infrastructure, it must include a well-distributed workforce, information systems for data collection, quality improvement analysis, and clinical communication support, as well as the organizational capacity to support culturally competent services and ongoing improvement efforts. To ensure a high-quality healthcare system, it requires the establishment of a supportive health system infrastructure. Without having a strong infrastructure, you are setting the system up for failure. Why do we need an infrastructure? Just like any system, you need a foundation, and the infrastructure is the foundation for the informatics system. Most may think for a good foundation, you need the best technology when designing an informatics system. This is true, but you also need a strong group of people to help bring it to life. An informatics infrastructure is not limited to just physical resources, such as existing hardware, software, and communication. It also contains non-physical resources, such as knowledge, plans, people, and skills. Using all the resources available will help to provide a strong infrastructure and lessen the chances of failure. Within an infrastructure, you have a team of people working hand in hand and the technology to help develop the informatics system. The team of people that help to create this infrastructure would be the higher management and board members, a member from each area, an informatics nurse, and IT. This group of people would help to build the infrastructure by using 5 essential building blocks. The 5 essential building blocks which help build an infrastructure are common language, available source, standard and guidelines, accurate processes, and workforce flow.
As mentioned, infrastructure is the underlying foundation or basic framework of a system or organization. Just like a brick-and-mortar structure, a medical information system requires a firm foundation or building blocks. The first building block would need to be common language. We have learned that in order for electronic communication to be effective, information must contain a vocabulary of terms with common meanings which are consistently used. To develop this lexicon requires input from all areas and departments affiliated within a medical organization. So to convey the language, available sources such as electronic hardware and software must complement, interface, and provide interoperability and access to other sources to be useful. The next building block would be standards and guidelines, which is information gleaned from medical systems and come from traditions and research across geographical lines that will support data collection and decision making. A system of accurate processes will provide confidence in the validity and consistency by which the system retrieves and disseminates that information. So up to this point in the building blocks, the focus has been on providing standardization and accessibility to the system. However, if the infrastructure fails to follow the workforce flow for either input or output, the entire system could be in jeopardy. In summary, putting all 5 building blocks together provides the organization with a strong foundation upon which to improve healthcare delivery.
Challenges of infrastructure. Some are such as data complexity. The more complex data that needs to be included in the informatics system, the more complex the task is in order to incorporate all of the data into the system. These become a challenge as to how to break down this needed data into software common language and programs so the end user will be able to understand how to operate, input, and interpret data accurately toward the ultimate department goal, which is to enhance the workforce flow. Incorporate informatics system guidelines based on HIPAA guidelines. The challenges faced concerning HIPAA include knowing who, from the end users, is permitted to access certain informatics systems and look into patient-specific information. For example, the radiology department does not need and should not have access into patient medications or past medical issues. The radiology department may need to know patient data such as name, social security number, date of birth, address for identification purposes, allergies, and the present diagnosis of medical issues. However, they should not be able to access patients' past medical and medications that patient is presently prescribed, since this is not pertinent to their line of work. Communication between IT support system and the end users. It is very important that IT support system have a broad knowledge and patience to be able to help and solve the difficulties in operating system by end users. 24/7 support system will be needed for several weeks and might be scheduled for every business day because the support system will save time and be faster to tackle the problems that arise during everyday system use. Having IT support that listens to end users' input will be a priority. The way to communicate the problems between IT supports and end users also faces challenges. 24/7 support persons that are always available in person and not just on the phone will create a greater financial burden. However, it will be a necessity in the future to have several real-life people helping with technical issues. Provide training for end users. At the beginning, the training must be intensive and have an evaluation period in order to determine the effectiveness of the system and the end-user capability to operate the system accurately. The challenges faced will be lack of computer literacy for some end users. This capability will be able to understand and to be able to remember which button or tab will bring the end users to the data that is needed at a time. Financial burden. With a new informatics system, financial issues will create more of a burden during the first trimester of the trial or go-live period. With projected goals of all end users being able to operate the system and be on the same page, then the need of IT on-site will be able to be reduced, and at the end of the trial or go-live evaluation, this informatics system will actually save time, improve patient care, and create greater profit in the end.
Hi, my name is Tran, and I will talk to you about the infrastructure future needs at the part of our presentation project. Well, nurses and technology are so involved in the way that healthcare is delivered. Clinicians and consumers are incorporating new technology solutions into their daily life. We need to prepare for the needs in the future and the informatic nursing infrastructure. The need to be the leadership nurse need to be the partner with the nurse executive to lead the technology changes that advance healthcare and delivery of healthcare. Nurse also support the development of informatic department, and also nurse need to foster the evolution of the nursing informatic by being a leadership role. Second, the need to be in education. First, by the transform nursing education into more informatic competencies at all level of the academic training. Second, by promote the continuing education in the area of the health IT. Third, they need to be in the practice. Form the basics of the 21st century nursing practice by ensuring the data, information, the knowledge, and the wisdom, incorporating informatic competency into practice standard in on a healthcare setting, and by facilitate the collection and analysis of the interpersonal healthcare workforce data that's collected from the existing health IT system. Um, Finally, the need to be with the policies. Nursing informatics leader need to be knowledgeable and engaged with the current public policies or the government regulation. Well, uh, hi, it's me again, Jackie Tran, and after you listen to the presentation about the what is the infrastructure, what we need it, the building block of it, the challenge of it, and the future needs of it. Now we come to the conclusion. Um, Currently, the nursing field and the technology go hand in hand together to complement each other within the healthcare field. Infrastructure is very important part of the technology system. The solid foundation or the infrastructure such as the necessity to have common language, available sources, standard and the guideline to provide the accurate process with equal efficiency and enhance the workflow of informative system in the healthcare. Like many things in this world, in order to create a solid infrastructure, this will require nursing to conquer several challenges in order for the informatic to system to become more efficiency and enhance the performance in certain setting, especially the healthcare field. The human interaction seems to be the main issues. How to communicate effectively and the computer literacy barrier are some of the main challenges. Some of the issues combined together with the burden to incorporate better software program so on data will not be missed, added with the HIPAA guidelines and financial requirement make it a challenge for the nurse and the IT personnel to create a correct, up-to-date and user-friendly informatics system. To foresee the quality in infrastructure information system, we as nurses need to be proactive and rely our great influence in the create more organized information system for the healthcare field. As nurses, we need to be involved in the revolutionizing the way healthcare is delivered. Nurses need to be educated more on the leadership, higher degree of education in informatics system to incorporate education and the leadership into the practice that remain consistent and follows specific policy or the guidelines such as the HIPAA regulation. Well, that's